So this, of course, is a participatory program. We invite our viewers to call in with your questions or to send them to us via the various electronic means that will appear on your screen. And we already have questions from some of our viewers who figured out the drill in advance of this evening's program. So we have a viewer who wants to know, and I think this relates to medical coverage, medical insurance coverage. What is the legislature doing to lift barriers to cooperatives and allow as many as possible to participate in cooperative plans? Viewer notes that farmers now have this option, but he thinks that this choice should be more broadly available. Who wants to take a run at that? Should we start with you, Representative Poppe?
Sure. Well, I do think, last year, the year before, must have been that we moved forward on the co-op plan to allow for farmers to be able to participate in that. That's been a really good thing because farmers, independent business owners struggle the most because they're having to come up with the money to pay for their own insurance and health care, and that is a struggle, especially in southern Minnesota. We just don't have that many options. So having a co-op has been a good option, and I think if there's a possibility to grow that, I know that some of the larger co-ops are doing that for their farmers, and I think that any and all options we need to be considering because health care is a super expensive endeavor for people.
Number one, I'm sure my three colleagues would agree, the number one issue on emails is healthcare across the spectrum, suburban, rural, urban. It's on everybody's radar. They want us to try to fix something and get it right and make it affordable. And so I'm willing to listen and experiment and let's get this right because people, it's the number one email we get.
Yes, it's been around for since the act under Obamacare, and it's been a challenge to say the very least, and it's been costing an awful lot. Now, healthcare, of course, is the cost of healthcare has gone up obviously over the years, and there's a certain amount of people that are unable to pay for their own healthcare, and I happen to think, I hate to dredge up old things, but we were doing quite fine before this came along. However, at that time also it was a lot cheaper, and that's not the case anymore. So we've got some bills there, I think, to help take the edge off for either tax credits for young families or just to help them pay with premium help. I think we just passed that off the floor just the other day, actually. Mm-hmm. So I've not served on that committee ever, so we've got an awful lot of folks that are real up on that and stay in front of that, and like everything else, you learn from that and you take from that which is the best and go from there. So,
Representative Anderson.
Yeah, the co-ops that we talked about, they're an option. They're out there. They're not necessarily a whole lot cheaper, but they do give farmers another choice to look into getting some coverage. And as Senator Ingebretson mentioned, we talk about health insurance, but the underlying cause is the high cost of health care. Mm-hmm. We have the greatest hospital system, care system, I think, in the world, in our state and country, but it's expensive. And I had some folks in the other day that talked about when you go in for a somewhat regular procedure, getting a shot or something like that, a lot of times the insurance companies are saying you have to get prior authorization. You have to come back 2 weeks down the road after the insurance company says, okay, you can get your shot. So it adds to the frustration, I think, from folks, let me get this done in one office call, things like that. So if we can try to work together and simplify some of these procedures and to not have the insurance companies really make the decisions that our doctors should be making, and it'd be better for everybody if we could simplify that and get the care people deserve at a reasonable cost.